My name is Allison Morrison. I am a student family nurse practitioner at Penn West University, and today I'm going to be completing a head-to-toe assessment on Mr. Morrison. So we'll go ahead and get started looking at general survey. Patient is pleasant, good hygiene, and not in distress. Next, the patient has been resting for 10 minutes. We're going to assess their blood pressure. So I will bring the arm up to heart level, and I will take the blood pressure in both arms. Go ahead and assess the other arm. Blood pressure of the left arm is 122/72. Right arm is 124/80. Those are within normal range. Next, I'll go ahead and assess the head. It is normal cephalic. Hair is evenly distributed. No masses or bulges noted. No tenderness on palpation. Next, we will look at the face. If you can look straight ahead at me. Face is symmetrical. No lesions, abrasions, no redness. I'll have the patient go ahead and smile. Close your eyes really hard. Open them really wide. Okay, that is testing the facial cranial nerve, which is cranial nerve number 7. Next, we will go ahead and look at the ears. The external ear on both sides. No redness, no drainage is noted. We'll go ahead and look in the ears. So I will pull the ear up and back. Tympanic membrane is pearly gray. Go ahead and same thing on this side. Okay. Tympanic membrane is pearly gray, no bulging, swelling, redness, or drainage, and no tenderness was noted. We will go ahead and test cranial nerve 8, vestibular ocular, and this is done with the whisper test. So I'll go ahead and have the patient repeat what I am saying.
Happy birthday. Happy birthday.
Okay, cranial nerve 8 is intact. Next, we'll go ahead and assess the nose. The patient says they have no trouble smelling, which is cranial nerve 1, olfactory. So we'll just go ahead and look up the nares. The nares are patent. Septum is midline. No lesions, bleeding. Mucous membranes are pink and moist. Next, we will go ahead and assess the eyes. So the patient looks straight ahead at me. I'm going to go ahead and flash a light in the eyes. Okay, the pupils do constrict with the light. Now I'm going to have the patient follow my finger as it comes to their face with just their eyes. Okay. All right, the eyes converge as the finger gets closer, as well as the pupils constrict. Next, we will go ahead and while looking at the left eye, I'm going to flash in the right eye with the light, and then looking at the left eye, flash in the right eye. Okay, consensual response is noted. Next, I'll have the patient follow my finger with just their eyes, not their head. Okay, extraocular movements are intact, no rigidity and fluid movement. Those are testing for cranial nerve 3, 4, and 6, which is ocular motor, trochlear and abducens. The patient also stated they had a recent eye exam and they did the Snellen vision test. They are 20/20 vision. That is testing cranial nerve 2, which is optic. Next, we would go ahead and do the red reflex test. Normally the lights would be dimmed for this exam. However, under the circumstances, we are going to leave the lights on. But I would stand 3 feet away from the patient, have them look directly at me. Okay, noting the red reflex is present. Then I would go turn the light back on, standing 3 inches away from the patient. I'm going to use my left eye to examine their left eye and my right eye to examine their right eye. Noting the macula, the optic disc, and cup are intact. The vessels are intact. No bulging, redness, or swelling. Examining the outer eye, the conjunctiva and lids. There is no redness, swelling. The sclera is white, no jaundice, and no drainage from the eyes is noted. So I will go ahead and assess the mouth. So I'll have the patient go ahead and open up their mouth, stick your tongue to the roof of your mouth, to the left side, to the right side. Okay, now stick your tongue out and say ah. Okay. Dentition is in good condition. No lesions, redness, no bleeding noted. The uvula rises and falls at the midline, and the tongue is symmetrical. No cracks. Mucous membranes are moist and pink. The uvula rising and falling at the midline with testing is the vagus cranial nerve, which is cranial nerve 10, cranial nerve 9. Cranial nerve 9 we would test with the gag reflex, but we're not going to do that today. And the tongue protruding at midline, test the hypoglossal, which is cranial nerve 12. Those cranial nerves are intact, so we'll go ahead and test cranial nerve 11, which is accessory, so I'll have them short shoulders against me. Good. And then while in this position, I'll go ahead and assess the trapezius muscle, the deltoids, and the quad. I'll just have you move your hands. The quads, those are all intact, no bulges or tenderness. Assessing the muscles, they are symmetrical throughout the body, no bulges noted or masses. So we'll go ahead and assess the throat. Trachea is midline. Feeling the thyroid, there is no goiter, masses, or nodules. I'll go ahead from behind and feel the thyroid as they swallow. Okay, the thyroid is smooth, no tenderness noted, no masses, lumps. I'll go ahead and assess the lymph nodes, so starting with preauricular, postauricular, tonsillar, submental, or submandibular, submental, occipital, posterior cervical chain, anterior cervical chain, supraclavicular, infraclavicular, no tenderness noted, no enlarged lymph nodes, and no masses. I'll go ahead and assess the carotid artery. 2 plus and equal. Go ahead and feel for the brachial pulse. 2 plus and equal. Radial. 2 plus and equal. Skin is warm, dry, and intact on the upper extremities. Assessing the fingers, no clubbing, no cyanosis. Cap refill is less than 3 seconds. So next we would go ahead and do a listening to the hearts and lung sounds. So we'll go ahead and listen to the posterior lung sounds. So just take deep breaths out of your mouth. All lungs are clear to auscultation, regular respiratory rate, they're non-labored, and no adventitious lung sounds were heard like rales, crackles, or wheezes, and no cough is present. So I'm going to go ahead and listen to the heart sounds. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay. No, heart rate and rhythm is regular. No additional heart sounds are heard. No murmurs. S1 is louder than S2 at the apex of the heart, and S2 is louder than S1 at the base of the heart. So I'll go ahead and listen to the carotid arteries with the bell of my stethoscope. No buries were heard. Next, we would do a breast exam. So normally the patient would have their shirt off and be covered with a gown. However, under the circumstances, we're just going to explain the breast exam. For the females, we would have them sit in 3 positions. We would have them sitting, and we would examine the breast, and then we'd have them with their hands on their hips and lean forward, noting any skin pulling, dimpling, masses, lumps. And we would next have the patient lay down. So if you go ahead and lay down with your hands at the side, knees bent. Hands at the side, please. Okay. We would go ahead and examine the breast again in this position, noting any masses, lumps, dimpling, or nipple discharge. For a male, we would also palpate the chest, feeling any masses or tenderness. And then doing one hand up at a time above their head, we would work down the axilla, noting any enlarged lymph nodes or tenderness. And then we would do the breast exam from an outward to inward motion and a counterclockwise motion, noting any tenderness, masses, or lumps. And we would do that on both sides. Keep your hands at the side, please. Next, I would go ahead and listen to the heart sounds again in this position. Okay. Then I would go ahead and feel for the point of maximal impulse, which I'd have the patient turn to their left side. I put my palm of my hand at the sternal border and fingers towards the apex of the heart. Okay. No thrills or heaves are felt. You can go ahead and lay back on your back. And it is brisk. Next, I'd go ahead and look at the abdomen, noting it is flat, umbilicus is midline, no obvious masses, lumps, or pulsations. So I would go ahead and listen to all 4 quadrants for bowel sounds. Bowel sounds are heard in all 4 quadrants. Now I'll switch to the bell of my stethoscope and listen to the aortic, femoral, and renal arteries. Okay, no bruits were heard. Next, I would go ahead and percuss the abdomen. Okay. Tympanic sounds were heard, which is normal. Any dullness would indicate a large mass or organ. So we would go ahead and do some light palpation to start. Okay, then working deeper. Okay, no masses were felt, no tenderness, abdomen is soft. Next, I would go ahead and assess the liver by putting my hand under the left side and the other one on the rib cage. You can go ahead and stay flat and just take a deep breath in and out. Okay. The liver did not touch my fingertips, so doing the same thing on the right side. Go ahead and take a breath. And assessing the spleen did not touch my fingertips. Next, I will assess the femoral pulse. 1 plus and equal. I would assess the inguinal area to note that there is no enlarged lymph nodes and no hernia is present and no tenderness on palpation. So I will go ahead and test the popliteal. Okay, you can go ahead and lay your legs flat. Popliteal pulse is 1 plus and equal. Post-tibial, 2 plus and equal. Post-pedal, dorsal pedis, sorry, is 2 plus and equal. I'm going to go ahead and take your socks off just so I can assess your toes. Okay, no cyanosis, and calf refill is less than 3 seconds on the toes. Next, skin is warm, dry, and intact on the lower extremities. No lesions or abrasions, no discoloration. We will go ahead and do some range of motion. So we'll go ahead and flex the knee up towards your chest and back down straight for extension. Same thing on the other side. and down. And we'll go ahead and flex the knee back up and test internal rotation and external rotation and down. And we'll do the same thing on the other side. Internal and external, back down. We'll go ahead and test abduction of the hip, adduction, and we'll come over and do the same thing on the other side. So we'll do adduction, adduction, good. Full range of motion. I'll have you come and sit on the edge of the bed here. And I'll have the patient go ahead and grab my fingers and squeeze as tight as you can. Pull me in, push me away. Okay, good. Now go ahead and curl your elbows up and then straight down for extension. Good. All right, we'll go ahead and assess his reflexes. Starting with the triceps, go ahead and relax down the best you can. Okay, doing the other side. All right, now we'll test the brachial. Okay. All right, and radial. All right, those are brisk. Go ahead and assess patellar. All right, and Achilles. We will just be doing the left side due to the right side had a recent Achilles tear. Okay. Normally we would do that bilaterally. Reflexes are brisk and present. I will go ahead and have the patient stand up and we will do some more range of motion. You can go ahead and step forward. Go ahead and push your leg out and back. Go ahead and back. Sorry, yep. And then same thing on the other side, forward, then backwards. Good. I'll have you go ahead, lean side to side, and lean back. Okay, and then touch your toes. Spine is midline. Good. We'll go ahead and put your hands out in front of you. Okay, up above your head. To the side, swirl around in circles. Good. Back down, and then put your hands behind you. Good. All right, full range of motion of the shoulders, full range of motion of the lumbar spine. Next, we'll touch the cervical spine. So I'll have you ear to shoulder, ear to shoulder. Good. Looking up at the sky, looking down at the ground, and rotate around. Okay, full range of motion of the cervical spine. Next, we will go ahead and check cerebellum movements. So rapid finger tapping. Okay. Good, and I'll have you walk that direction, and then on your toes, back, and then back on your heels. Good, alrighty. So those cerebellum movements are intact, full range of motion, gait is steady, symmetrical, and that does conclude our exam. Thank you.